Hello, everybody. This is Dr. Dan Carlicchio. I want to welcome you to another segment of Destination Health Podcast, Finding Function in a Dysfunctional World. And I am here with my good friend, Dr. Aimie Apigian. Dr. Aimie, how are you today?
Dan, it's always so good to see you. That now I'm great now. I would have said that, I'm good, I'm okay. But now after seeing you, I am great.
Thank you very much, because we actually just spoke for an hour prior to the podcast where we had a podcast and we can't even tell you what was discussed. We were hysterical. We were laughing.
Top secret stuff.
Top secret stuff. Only for your ears only. But it was very fun. I did have Dr. Aimie on the floor, hysterical laughing at one point in time, but that's okay. Is it true? Is it true?
I have not laughed this hard since Rona, probably.
So let me say something that my French teacher, Miss Michalski, when I was in high school, sophomore, junior, and senior, she taught us French. She worked part-time for NBC for Saturday Night Live. Mm-hmm. And she got me a tryouts, when you go and you see if you can make it. I didn't have any formal training. So of course I got to take, one of my parents, because I'm underage, I'm doing this. I can't even go on the show, but I said, I'm going to go. I made multiple rounds.
Of course you did.
you know that I did. So anyway, Dr. Aimie's been on our podcast before. She's board certified prevention and addictive medicine, double masters in biochemistry and public health, biochemistry here and nutritional biochemistry. She is a general surgeon. She's a general surgeon. She's one of my favorite people that are named Aimie, or just have a name. And today we're going to get serious, and we're going to talk about some mental health issues that are going on, especially with the pandemic and the coronavirus and so forth. We're going to talk a little bit about resilience. We're going to talk about stress, anxiety, mental health, and it's an important topic. I'm having more and more patients coming in, and I'm referring them out because I'm not a psychologist or I'm not a psychiatrist, but I do see an incredible uptick in mental health issues, Aimie, right now, due to this, homebound and not working. There's not a lot of social interaction. So what are your thoughts on some mental health issues over the last year and a half?
Well, I've got a lot of thoughts. I'll start somewhere, and then you share your thoughts on that. My first thought is, this has actually always been there. And this situation only has brought it to the surface. Mm-hmm. But the issues have always been there. And for me, the issues are what I would call stored stress, stored trauma in the body. When I talk about stored stress and trauma, I'm specifically talking about the nervous system, because that's our survival system. Mm-hmm. And so that's where trauma gets stored if we don't have the tools, the knowledge in order to process it as we go along in life. And so here we've been a society where we've got all this stored stuff in our body. It's affecting our health, it's affecting our life, it's affecting our relationships, but not to the degree that we may even be aware of it. And certainly we have not experienced enough pain from it in our life that we have to do something about it. Right? We know this. You're not going to do anything in your life. You're not going to make any changes in your life until the pain, the suffering of continuing to do that is greater than the pain of change. So it's always been there, but we just haven't been aware of it until something like this happens, where all of a sudden people's coping mechanisms, people's routines, people's habits that they had built into their life for maintaining a functional enough mental health were taken away. Mm-hmm. And they didn't have other tools. And then all of this stuff comes out. And so this stuff is just coming to the surface. And for some people, it's looked a lot like anxiety, right? Which of course we understand, because there's been a lot of fear. And I don't care where you are on the spectrum of the COVID virus and the vaccine and the pandemic, on all sides, on all fronts, there's just been fear. And That fear, we can talk about the trauma response in the body, because that fear is what will really set things off and actually push a person into what I call a chronic functional freeze state, where then they start to experience burnout, overwhelm, depression, chronic fatigue. They wake up and they don't want to have woken up. They would love that escape. They would love to be able to just pull the blankets over their head, pretend that none of this is happening. That is all part of this chronic functional freeze state that happens when we have stored trauma in our nervous system. So that's what I got for you.
Well, boy, I have a million questions that I'm thinking of, and we have about 45 minutes. So, I mean, of course, we're going to have you back on. But when you say stored stress, let's just go over that. We discussed that in the first podcast we did. Just give us a brief synopsis of stored stress, stored anxiety that we have. What does that mean?
Yes. And in order to explain this, I will say that there are 3 different states of the nervous system, which is awesome because we can take this very complicated topic of trauma and be like, nope, we're going to simplify it. A person is always in one of the 3 states of the nervous system. That's it, because there's only 3 states. And so when we talk about stress, we talk about what is also called a sympathetic state, which is a high energy state. And so when a person goes into a stress response, they go into that stress response after some kind of a startle. So a startle is always the first step of that stress response. There's a startle, and this can be a startle, anything that's actually, ooh, a car is coming towards me. Are they going to stop? Right? Like that's a startle, but it could even be like, oh, there's somebody on the news. Oh, there's an email. What's the email going to say? So there's all kinds of startles, but the startle starts the stress response. And then our nervous system goes into the sympathetic state, which is high energy. And what's important for people to understand about this is that in this state, it's always geared towards action and movement. I am going to be taking action in self-defense because my life feels threatened. There's danger. I need to protect myself in order to survive. And so there's this action, there's this movement that's part of sympathetic response. And we'll talk about the freeze response, because what happens is, what can happen, and it becomes a trauma, not just a stress, is that if that movement, if that action, if we do not take action to protect ourselves, we actually then go into this trauma response that's called the freeze response. And it's not that we stand there frozen. That is not the freeze response. But in the freeze response, we actually are kind of giving up the fight. The sympathetic is all about fight, right? Fight or flight.
Right.
When we go into the freeze response, it feels like we're giving up the fight because we have chosen in a subconscious way, right? To not take action.
And it feels like you're frozen, though.
It feels like you're shutting down. Yes.
Right. Because there are individuals and patients that I've had where they say they feel immobilized, they feel frozen, like in a straitjacket type of a situation, and they don't do that. So in this pandemic, what was that situation that created the fear? And we're not political, we're just scientists. We're both physicians. We're just talking. We want to motivate, we want to educate, we want to inspire. We don't want to do anything else. You know, you and I have spoken about that at length for many different things. So you know, there's that fear. This whole thing was just fearful. Right?
Yep. Yeah.
And
so
go ahead.
When I started seeing things shift, and I saw on a social level, Dr. Dan, on a worldwide social level, masses of people moving into the freeze response, was when the news came out that, hey, there's this thing, And what was important about it is that we don't know what it is yet, but we know that it's deadly.
Right. And once you say that, there's the fear of the unknown. because we
Yes,
don't know what it is, right?
exactly.
And
And
then it's deadly, fear of the unknown, and then it's deadly, and we're like, oh,
right. And we normally, so what our nervous system is designed to do, our nervous system is designed to move into action in response to a threat.
mhm,
But when we don't know what the threat is yet, we don't know what it is. We don't know how we're going to get it. We don't know how to protect ourselves.
mhm.
We don't know. So we can't move into action. And when we're not able to move into action, the nervous system, in order to protect us, shifts and goes into the third state, the freeze state. And so all of a sudden now you have these people who are literally like, their eyes are big. They're walking around in so much fear, and it's a fear paralysis. It's a fear, and I'm just gonna, oh, Dr. Dan, it's a fear. What happens when we go into the freeze response is that there is a strong characteristic that happens to people in the freeze response, which is called automatic obedience, where they will just do what they are told to do because
Right.
they're just going through the motions. We see this in a trauma response. So again, I don't want to make this about Rona. This is the body. This is trauma response. And
This is what happens. This is what we know to be
this is
true.
what happens. This is the nervous
Right.
system. Say a person is on the streets of New Jersey, right? And
Oh, forget about it. Oh,
they run into one of your gangs, right? One of your gangs.
oh, forget about it. Yeah.
Forget about it, right? And they're held at gunpoint and they're told, hand over your purse, hand
I've
over your
never
wallet.
seen this happen before. This is something new. So
Entirely hypothetical, would never happen in New Jersey. But say it happens, right? And that person, when they see that they're surrounded, when they see, oh my goodness, there's a threat, but I cannot take action because if I were to take action, they might kill me. That's not an option then. My best option is to go into the freeze response. And part of the freeze response is just this automatic obedience. Oh, they want my purse. Okay, here's my purse. Oh, you want my rings. Okay, here's my rings. What else do you want? Oh, my neck. Yes, I'll give you my necklace. They go into this automatic obedience. Later on, afterwards, after they've come out of that freeze response, they hate themselves for having
that was
done
my
that.
question. How do they feel?
They hate themselves.
How do they feel after
why
that?
why did I just hand everything over? Why didn't I do something? Why didn't I say no? Because you're in the freeze response. Your nervous system will literally not let you do that when you are in the freeze response. And so we can look at what has happened on a social level and be like, wow, like there are so many people that have just gone into this, I will do whatever you tell me to do. How could this happen? It's because they're in the freeze response. Like that is literally their body's programming to survive something that for them has become so fearful that it has overwhelmed them.
So you mentioned the coping mechanism.
Yeah.
And we're not able to cope with this freeze.
No.
We're not able to cope with this freeze
No.
mechanism. So the coping mechanism, can this be learned? Is this something that is, if you go through an experience in life, and I'm not speaking from experience,
Of course
but
not.
of course not. Growing up in northern New Jersey, growing up in North Newark,
Easy, simple life. You were treated, just
Mayberry, that whole,
yes.
So is this a learned response? Like if you get more experience in these coping mechanisms, if you get experience in these coping mechanisms and you're around different experiences, can you learn from this? I mean, because I remember last month coming out of the bank, and I came out of the bank in my northern New Jersey office, and I had money in one hand, I had my wallet in the other hand, and I'm saying, I don't know, it was a busy day, Dr. Aimie, and I didn't know whether or not I got the correct money. I think I was on the phone. I apologized to the teller because I was being rude, just a lot of phone calls. And I'm counting the money, and I looked around and I laughed, and any one of a half a dozen individuals, but nobody said anything to me. I must have had the look on my face. But anyway, is that a learn? Can you learn and you can cope more?
Wow, there's so much to unpack there. So yes, the freeze response can be a learned response. And by a learned response, let me just make it very clear that this is part of our instincts. So this actually comes wired into our nervous system from before we're born. This is a nervous system, and this is the same nervous system that we share with animals, right? Like we all have this survival design that will take over and actually overpower certainly any logic, any brain stuff. Our survival response will always overpower that in the moment. And this kind of stuff, even starting in childhood, if a person experiences any situations that feel overwhelming to them, they will start to go into this freeze response. And it's almost like you could say that the freeze response is a coping mechanism for the fear that they experience. The fear becomes so much that their body is like, we can't sustain this amount of fear. We're going to die from a heart attack just from the fear and the anxiety. Right. We've got to shut this down. We've got to bring down the intensity of the fear. So we're going to go into this state that we call the freeze response. It's all communicated to the vagus nerve and that dorsal vagal nucleus, and it shuts things down, and it puts us into a numbed out state. Those are the benefits of the freeze response. It numbs us out so that we don't feel the intensity of the fear. We don't feel the intensity of the overwhelm and the panic. So the more times that a person has experienced this type of overwhelm and fear in their life, the stronger they develop their freeze response. And the sooner they will go to the freeze response at the earliest sign of stress, of anxiety, of fear. And so now a person just, needs to hear a song on the radio that reminds them of something, and they're gone. Yes. They go into that freeze response. It can be such a well-paved highway. It becomes their default for life.
Can there be at times where it goes the opposite? Instead of they go into freeze, they can cope better. Is there anything like that happens? Or that's like unique and I need to go to therapy or something like that?
No. So there are some people that get stuck in sympathetic and they get stuck in the stress and the anxiety and the high energy state. The freeze response is a collapse. It's a low energy state. It's where you would, kind of, it would be somewhere their head comes down, their shoulders come down, they go into that shame posture. That's the freeze response. A person can get stuck in the sympathetic response, which is more of a, like fight, right? This is how I see Dr. Dan, right? Like, what are you doing, right? Like, boom, I'm going to punch you right back, and it's going to be harder, right? So you can have that. And that is actually, right, if we're going to talk in terms of health, that is healthier than going into the freeze response. And that's what a lot of people don't understand. So I'm glad that you brought that up.
Yeah. When you get into sympathetic, is it that you're fighting back?
Yes.
Is your body fighting back? Is it saying that something's not right? And I don't know perhaps what that is, but I need to fight back now.
Yeah. So what happens is that if because that startle, that sympathetic response is the first response of the body, of the nervous system to a threat. And if you're able to maintain that high energy state, yes, you are taxing your adrenal glands. Yes, it's pumping out cortisol. Yes, you're having all the downstream health effects from that. But there are even more chronic health effects from going into the freeze and the shutdown.
What are those chronic health effects?
Autoimmune, chronic pain, chronic fatigue, fibromyalgia, depression. Those are the biggest ones. A lot of digestive system issues, though. Brain inflammation, those primed microglia, all of that tends to happen in the freeze response. And so what a lot of people do is they may have started out in sympathetic dominant, right?
Right.
They may have started out there, but now they've burned the candle at both ends. They're not able to maintain that anymore. And so now they're noticing that they come home from work or they're at the end of their day and now they're going into the collapse. They're going into the exhaustion. They're going into, how do I check out? Let me grab that extra glass of wine. Let me eat 2 portions of my meal.
Mhm.
Let me use these as mechanisms to numb out. All of those mechanisms that people use to numb out. And some of that is even busyness, right? Overworking, addictive tendencies. Those are all
Right.
ways to numb out. That is all part of this chronic freeze response.
You know what?
So
One of the reasons why I love talking to you is because, you educate me and I see things clearer. And one of the issues that we've been discussing, in the offices is that, of course, people are gaining weight, 29.6 pounds. I think it's 50 pounds, to be honest with you. You see the uptick in the diabetes, you see the uptick in the autoimmune, you see the uptick in poor eating habits, lipid panels, and so forth. And this really, you've just put this together for me: chronic freeze state, fear, paralysis, automatic disobedience, hating yourself, and then it just leads into something that's deleterious, where you're not going to do the right thing for your body. You're not taking care of yourself mentally, physically, emotionally, body, mind, spirit type of a situation. And you just put that all together. So I want to thank you for that, because I'm sitting here and, I'm thinking that I have so many patients that are coming in, there's the increase, like I said, in the diabetes and, and being overweight. This makes sense now. Why this is all happening? Is that, am I on to something here?
yes, that's exactly what happens. And this is why I've been, trying to tell people, like, look, when we talk about trauma, there is a whole biology of trauma. It is not psychological. This is the biology of the nervous system, right? Like I've got a master's in biochemistry, so I love geeking out about the science, and I'm looking at, like, no, like there is actual biology that is happening here. And you may see a patient with autoimmune. I see a patient who's been in chronic freeze.
Right.
And the autoimmune is only a part of that chronic freeze biology that's playing out. And so, no, sure, give them the low dose naltrexone, give them whatever else for their specific condition, but the nervous system and this chronic freeze is continuing to drive that. And so we've got to address the root biology of trauma that's happening in people.
Is there like a stress response for somebody who's got a master's in biochemistry too? I mean, was that something that we had that shared pain? My nephew over the summer was taking organic chemistry. He was at the Jersey Shore. He's doing it virtually, and he said, "Uncle Dan, do you have a master's in biochemistry?" I said, "Yes, I do." And he said, "What is this?" He goes, "I can't figure it out. I just looked at it and I walked by and I said, it's the Grignard reaction. I mean, how could you not figure that out, buddy?" He's like, "Oh." I said, "You don't know what a Grignard reaction is." I said, "You should go back to general chemistry, start taking it from there." And he was amazed that I remember that. But then that was put into our brains many, many years ago. I can still see the anyway.
Yeah. No, in the new edition of the DSM-6 that's going to be coming out, there's a special diagnosis for those of us who have a biochemistry master's, and the PTSD and the trauma response that's unique just to biochemistry.
Yes, it is.
And organic chemistry too.
Yes.
They lump those together. I'm not sure that they should lump them together in the DSM-7. They may need to split those apart.
You got to start somewhere. You got to start somewhere. And then we can do that. My organic chemistry professor was one of the main individuals who developed a chemical used during the Vietnam War. He was brilliant. We just wanted to know what he had. We do have a bunch of people listening to us, Dr. Aimie. And if anybody has any questions for Dr. Aimie, please put them into the comment section and I'll make sure that she gets them. Now, so we have all of the situation.
Yeah.
We got freeze, we got paralysis, we got obedience, we got hate. You know how I kind of just use one word for each one. Then we have health conditions, right? We got some physical conditions, we got mental conditions. What do we need to do to get out of this?
Well, for one thing, we've got to learn how to do this for ourselves. We have to learn how to
Right.
understand what's happening in our body, and not just rely on, I'm going to go see a therapist. I'm going to go see a counselor. Oh, I'm going to go do a meditation. It's like, that is no longer, it never really was, but it definitely at this point is not going to be enough to actually shift the biology that's been playing out in someone's life. And so where I start with people is like, look, I got to teach you how to track your nervous system so that at any given moment, you know which state you are in. Ooh, I'm in freeze response right now. I'm in sympathetic right now, or I'm doing good. I'm in rest and digest. I feel connected. I'm engaged. I'm present. Yeah, there's stuff going on, but I feel on a gut level that things are good. Things are going to be okay.
Mhm.
I need people to start knowing exactly where they are and then having the tools to shift that in the moment. Because what happens is that we live in this state chronically, and we go and see our therapist, 5 days from now or next week. We have an hour. We talk about things, which means that we're all using the logical part of our brain. So we're bringing up old stuff. We're bringing up memories. So that actually probably will put us back into the freeze response. So we leave our therapist, now we need to go drink that soda, watch that movie, all of this emotional stuff that is brought up in my therapy. And it's like, we've got to figure out a better way of actually dealing with what's happening in our body, because it's been accumulating over our lifetime. And we've got to start unburdening ourselves from that. And it's not an overnight process. It's not a take this pill and you'll be fine. This is a new lifestyle that we need to learn of how do we actually process life as it happens to us, so that we don't continue to accumulate stress and trauma that then will eventually break us and result in physical, mental, and emotional health conditions.
So recognizing what state you're in is important. Freeze, paralysis, obedience, hate.
Yeah.
All right. So let's go to the freeze state. That's the first one, right?
Yeah.
One quick tip for success to get yourself out of that. What do you recommend to do that?
Okay. So for one thing, when a person, there's different types of freeze response. So there's an acute freeze response when something very immediate has happened, when you're in the middle of an event, a trauma response, but then there's this chronic freeze. So getting out of the chronic freeze is not something that's going to happen immediately. It's something where you can start to train your body, though, to just be more present.
Mm-hmm.
And then with that, people will start to notice how much they are not present. Mm-hmm. Like we as a society don't even know that. We don't know that we are not fully present. We've never felt that. So how would we know that until we actually are? So what I use a lot, I adapt a lot from Peter Levine's work with the trauma work and somatic work. So somatic experiencing is one of the 3-year trainings that I have been through. And I bring that a lot into my medical work, which has been a really cool thing to integrate those two. And then also neuroaffective touch, and being able to look at how the nervous system is designed, how it actually can be directly worked with on an individual level. So again, this is not something that you need to go in and, sit on someone's couch or, do whatever. You can learn this stuff yourself. So for overwhelm, and that's kind of how I talk about the freeze response. People don't know freeze, but they know overwhelm. So with overwhelm,
everybody's overwhelmed every single day, no matter what it is. Family, in-laws, your job.
Yes.
It's all.
And if that is something that you are feeling, and if those are actually the words that you hear yourself say, you are in a chronic freeze response. It's a functional freeze response because you're still doing life, but you're living in a chronic functional freeze response. So some of the things that are really fast for people, really fast and really simple, one would be your feet. So people can find the pain points in their feet, put some gentle pressure with their thumb, and that will bring them back into their body pretty quickly. Another thing that I do is a lot of different exercises and movements. Again, like we talk about the sympathetic response
Right.
needing movement. Movement is how we work directly with the nervous system because the nerves control our muscles. So we actually move our muscles, we engage our muscles in order to interact and work with the nervous system. So I will teach people an exercise that's really helpful for overwhelm, where they put their hands up and they start pushing away as if they're pushing a really heavy rock. So they're having to go slow, and they go all the way out until their arms are fully extended. And oftentimes, not always, but oftentimes when people start to do just that exercise, they don't even have to be thinking about anything, right? It's not like, oh, imagine your mother-in-law and pushing her away. No, right? Like they don't have to actually do any of that visualization stuff. They're literally just doing the movement of give me space. I'm pushing things away. Give me space. I need to breathe, right? Because another thing with the freeze response is we don't breathe. Our breath becomes very shallow and very low. So even just talking about then bringing in masks and how masks have played a role in contributing to chronic freeze response would be a whole nother discussion. But just doing this movement of, I need to breathe, let me breathe. And what will often happen is that a person will take a deep, spontaneous breath. And that's how we track the nervous system in the work that I do with the body. I don't have people do breath work because I'm using the breath as a way to track the nervous system. And when I see a person take a spontaneous deep breath, it was not intentional. It was a spontaneous deep breath. I know that they have just shifted their whole nervous system closer towards parasympathetic and health. And so we want more of those moments. We want more of those kinds of spontaneous deep breaths, because that's the nervous system. The nervous system controls our breathing. And so it's a really cool, really easy way for us to be like, oh, look at you. You just shifted yourself. Look at you.
Awesome.
Right?
Awesome. Now I'm sitting here and I'm listening to this and I'm thinking about one word in this cascade is the obedience. That just bothers me.
That got you, didn't it?
Boy, is that bringing up some stuff. So for somebody like, oh, you have no idea. You'll hear it when we get off.
Exactly. I'll hear about it later.
Yeah. You'll hear about it later. How do you get out of the obedience stage? Because in my mind, and correct me if I'm wrong.
Yeah.
Okay. There's a freeze state. You got to get a little paralyzed. But it seems like you can get caught up in this obedient phase for a long period of time, Dr. Aimie.
Yes.
Boy, that just goes against, my whole fiber of every fiber in my being, the way I was brought up, the way I think.
Yep.
To get me to an obedience stage, boy, that's you gotta be really good.
Yep.
That doesn't happen. But if somebody like me gets into that obedience stage, how do you get me out? If I was your patient, what would you do to get me out of that obedience stage? I find this fascinating, by the way.
And what I'm going to share with you is usually what I don't share with people, this stuff. So I will share it with you because you've asked. And I know that you want to understand.
Just one little tidbit. We don't, I'm just curious. I'm curious.
Exactly.
About it.
Yeah. So the way that the nervous system is designed, when it has gone into a chronic functional freeze response, in order to come out of it, it needs to have the energy to feel like it can pick up the fight again. You're not going to go from chronic functional freeze to rest and digest, parasympathetic, all is good. What a person is going to go back into, and this is so much of what I work with my people, right? It's like I work with them for about 2 weeks, and then they start to notice, like, wait a second, Dr. Aimie, I'm actually having more anxiety. What I thought you were helping me with overwhelm. What is going on? And I'm like, yay, you are on the right path. You are actually following the normal stage of coming out of the freeze response. Because when you come out of a chronic freeze, you are going to go right back into that place that puts you into the freeze.
Mm-hmm.
And what put you into the freeze was fear, was terror, was panic, and the inability to take action to respond to that fear, to that terror, to that threat.
Mm-hmm.
And so when a person starts coming out of the functional freeze, the chronic freeze, they now start to feel again all of that fear that was so much that it put them into the freeze response.
Mm-hmm.
So if they don't have enough energy, and this is where I have to work with their biology, because if their mitochondria have compromises,
Mm-hmm.
right? If they've got a lot of inflammation, they're not coming out of the freeze response. They're not. They're going to be stuck there, Dr. Dan. They're going to be stuck there. So this is where the biology plays a really important role. But if they're able to come out of that freeze, where they're coming is into the fear. And
Mhm.
so the key to not going back into that automatic obedience and the freeze response is being able to take action,
Mhm.
having a plan. Because if you come out of the freeze response and you're met with this overwhelming fear and you don't already have a plan in place of how you're going to take action,
Mhm.
your nervous system is going to be like, whoa, nope, this is way too much. We're going back into the freeze response.
We're going right back to the
Exactly.
beginning.
Right back to the beginning. And so this is what I see a lot of, right? And I know that you see this too, where people will, come out and they'll be like, yeah, I'm going to do something. And then they don't. What happened? They didn't have enough of a plan put in place. They came out of the freeze and it was overwhelming and they went back into the freeze. And so this is where we see again, that pattern of going, they're stressed and then they go into overwhelm and shut down and don't do anything, go into obedience. Then they're stressed. I'm going to do something, but then that overwhelms them and they go back into the automatic obedience and that freeze response. So it's quite fascinating when you see this being played out on a social level and
Mhm.
realize that this is actually just all happening on a cellular level.
Yeah, you know what? I asked you that question for two reasons. Number one, I'm just really fascinated and interested in your work. I mean, 100%. And secondly, I like to motivate, educate, and inspire, because if somebody can hear this and they can relate,
Yep.
and they're saying, "This is me," you need to contact Dr. Aimie, because if we can get one person into your program to help them out, the 2 hours that we spent the first hour talking and the second hour doing the podcast is well worth both of our times in helping out some individual. So
that overwhelm becomes our biggest thief for our health,
right,
for our mental health, for relationships, for our career, for everything, because it's that overwhelm that will then drive us to remain holding ourselves back.
and it's interesting what you just said, mental health, and it has me think of what I've discussed with a neighbor of mine who is a therapist, and she's into addiction and so forth.
Yes.
And she said there is an uptick in drugs, an uptick in alcohol, an uptick in spousal abuse on all different levels.
On all levels, yes. Addictions
it's through the roof. And the abuse goes with kids, brothers and sisters, husbands and wives and husbands. It's everything. It's mental, it's physical, it's emotional that they're going through. I mean, the running joke is during the winter in Alaska is that you're going to have 10 kids or you're going to get a divorce because you can't stand your spouse.
Exactly. And that is all of that. Both sides of that are a dysregulated nervous system from these imbalances in it of going back and forth between sympathetic and freeze. I need a coping mechanism. I've got stress. I don't know how to feel that in my body. So I need to get busy. I need to have sex. I need to work more. I need to work out more. I need to eat more. I need to, whatever it is, right? Like we just have this inability to, we haven't been taught. We have not been taught how to actually deal with stress in a way that is healthy and constructive.
And for everybody listening right now live, or if you're listening to this, record it, boy, this is affecting all of us to varying degrees.
Yes.
It's affecting all of us to varying degrees. And I'm going to say, please reach out to Dr. Aimie. I don't have the tools. This is not my wheelhouse. If you tell me that you've gained the 50 pounds and you're diabetic now, from that functional medicine aspect, I can help you. But Dr. Aimie is getting into areas. I mean, reading blood work is easy to me. You're getting into those, vacuums.
I read the nervous system.
Right. You're getting into the vacuum of the brain where it's really difficult to do.
The brain and the body. Yeah. It's just as much the autonomic nervous system, not just the central nervous system, the whole autonomic nervous system that is designed to keep us alive, and then can develop these ways of keeping us alive that actually are quite maladaptive over time.
My job is easy compared to yours, to be honest with you. My hat goes off to you because, like I said, for me to read blood work, food intolerances, you got a intestinal permeability, you have diabetes. I mean, not that it's easy. I don't want to make it sound like that, but to me, I've done it so much. To me, you have to go into the recesses of that brain and look for those triggers, which is, in my opinion, just a lot more difficult to do. So thank you for being you in doing that. So where do we go from here? What do we do from here? What's the next step for society then?
Well, I think that this is a really awesome point in our world's history where we actually have the potential to make some powerful shifts that will affect all future generations. So as much as there's been this dark cloud about the pandemic, I see this as a huge opportunity because we are now realizing things that we never realized before.
Right.
We didn't realize that our mental health was actually so fragile, right? We didn't know that there was all this stuff right underneath the surface that, oh my goodness, all you need to do is tell me that there's this virus that I don't understand and that it might lead to, all this kind of stuff. And I'm in fear and I'm eating chocolate ice cream and I can't stop, right?
Right.
So I see this as a huge opportunity for us to be like, let us step back and let us really get to know how we can do life very differently, because how we have been doing things is no longer sustainable. Right.
I think that we can be better.
We can be much better. And we've got the tools, we've got the knowledge. It's just now people are ready for this now. They weren't ready for this before.
If that's what comes out of this, so be it.
Right.
I mean,
so be it.
It's not bad. It's not bad,
exactly.
to live on a higher plane, to be better.
Yes.
And I got a lot of flack for this, by the way. Oh boy. Friends of mine just defriended me on all social media. And I think I put this up because I don't know, in discussing this conversation today, I put up a post, the social media put up a post that said something to the effect, if you don't come out of this better skills. And I think people took that as business, which you can do too. Sure. But to be a better business person, you have to be a better person to begin with.
Absolutely.
Am I right, Dr. Aimie?
Yep.
You have to be a better communicator, whether that's with your spouse, whether it's with your children, or it's with your parents, or it's with your clients or patients. This is the opportunity to do that, to become a better communicator. So it didn't have to be in business but
Right.
yet it can be in business, whatever that means to you.
Mhm. Yep.
Were you thinking about pivoting your business and you were looking to answer a question?
Yeah.
Well, no matter who you were, as that entrepreneurial spirit, that you're able to solve a problem that's out there. I mean, that's
Right.
what business is to me. I had this
Yes.
conversation yesterday where, people think business, money, 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 money. To me, it's solving a problem. The money is always secondary. And you and I have discussed this before. The money is secondary that comes in because you were able to figure something out and you were able to help out individuals. You were able to serve humankind, in other words.
Yep.
The money comes, and I think people they look at me as this entrepreneur, like, oh, you're just talking about business. No.
Life.
Yeah. Listen, if you want to be a real estate person and you're going to create 10,000 jobs being in real estate or insurance or whatever that is, you and I aren't into that. That's not our wheelhouse. We don't have those types of brains. Although I do real estate. I kind of have that. But I'm saying, if you're going to make a company and you put that together 10,000 jobs and you're paying for the insurances and you got this and you got that, you're helping families out if that's what you want it to do. So it's not about business. It's about serving humankind. It's your employees.
Yes.
It's your family. It's society. It makes society stronger. It makes the economy stronger. It's everything. It is just not, people look at money. Yes, money, it's important, but it comes if you're solving problems.
And this is why this is a big problem right now, Dr. Dan, because you cannot solve problems. It is biologically impossible for a person to solve problems when they are in the freeze response.
I may be a different study in this, so we're going to have to discuss this offline. But
I'm not sure you're in the freeze. I think you can tend to be sympathetic, but I think a lot of what you do is still in parasympathetic. But biologically, just biology on a cellular level, biochemistry, you can't, like, the nervous system cannot be curious and ask questions when it's in the freeze response and overwhelmed.
Right.
And
totally.
This is where a lot of people will start to experience shame because they feel like they need to. What's wrong with me? Why can't I? Well, the first thing is just, let's get you out of the overwhelm.
Right.
And actually that shame that you're putting on yourself is only keeping you in the overwhelm.
And it makes it worse.
So a person's most important job, this is what I say all the time, like, your most important work for the day, every single day, is not anything else. It's not your to-do list. It's not. The most important thing for you to do is get into parasympathetic and stay there, because then you are going to be able to have the curiosity. Then you're going to be able to actually ask the right questions. Then you're going to be able to have that perspective of, here's my way through this. Here's what I can do. But besides that, if you're not in that state, you're going to be like the hamster on the wheel. I don't have time to think. Let me just do.
Right.
And you're going to be making mistakes, or you're going to be in the freeze response and so overwhelmed that you don't give a care anymore. You don't have the energy to care. So do whatever you want. I don't care. I'm not making any decisions because I don't have the energy to care.
Right.
So a person's most important work every single day for all areas of their life: get out of the overwhelm, do the exercises, learn how to work with your nervous system, get into parasympathetic, and learn how to stay there, because many people can get there when they're on their yoga mat, when they're on the meditation pillow, but that's not where it counts. It's when you're in the meeting. It's when you're with your spouse. It's when you're having that confrontation with your kid. That's where it matters the most.
Right. When life hits you hard.
When life happens. Yeah.
Right.
Yeah.
Right. That's where it is. So, oh boy, this has been incredible. Boy, we got a couple of minutes left. Listen, Dr. Aimie and I have said, after our first podcast, we said that we were going to do one every, 4 or 5 weeks, and we're going to continue on because, as you can see, we're both passionate about our chosen chosen fields, and we do want to make an impact in this world. We do want to solve problems, and you can call it entrepreneurial, you can call it whatever you want. To me, it doesn't mean, words are meaningful to people. Sometimes they're not. You want to call me entrepreneurial. To me, that means I'm solving a problem. Money does come after that. That's okay, because you get paid for your services.
Yeah.
You have to serve humankind, whatever that is, no matter what it is. If you're doing a tax return, you're serving humankind, you're helping somebody out. I mean, that's if that's what your wheelhouse is. So Dr. Aimie and I are very passionate about this, and we're going to continue on with this conversation. And if you feel incomplete right now, like I do, it's okay, because there's more to come, and there's more answers, and there's more questions, and there's more answers. Dr. Aimie, wow. I don't know what to say. I mean, thank you is just not enough. But
well, you're welcome. And yeah, like, I just love having these kind of conversations with you, because we can go really deep into certain areas, and also appreciate how much more there is to talk about and explore and to help people, right? Because for me, it really comes down to, there is unnecessary pain happening in life because this information is not out there. People don't understand this yet. And so they're having problems with their health. They're having problems with their family. They're having all kinds of problems. They're stuck in overwhelm. They're all kinds of stuff, and it's unnecessary. And so let's help them. Let's help them out.
Let's help. Let's motivate. Let's educate, and let's inspire. So, Dr. Aimie, where can people find you?
Yeah. So I lead people through a 21-day journey. And so that would be the place where I would start if they're experiencing overwhelm or stress. Let's start with that 21-day journey. And it's a journey into their nervous system. It's not a journey about their nervous system. There's a safety in being able to just keep things intellectual, right? No, we're actually going to take a journey into and experience their nervous system, not my nervous system, their own nervous system. And I guarantee you that they're going to see and experience things that they have never seen and never experienced before, which is awesome, which is really awesome. So they can find all of that at traumahealingaccelerated.com. So traumahealingaccelerated.com.
Trauma Healing Accelerated.com. I have that.
Yeah.
I'll make sure that it gets into the show notes.
And obviously there's a www dot in front of that. But that would be where people can find that, because that is what I do, right? Like, I'm here to help people address the biology of their trauma, but let's also do this in the most accelerated way possible. And that is possible, so that we're not stuck years in therapy and still hashing the same stuff. I'm 100%. A surgeon. Let's cut it out. Let's get it out.
So for those of you who don't know, Dr. Aimie is a medical physician. She's board certified in prevention and addiction medicine. She's got a master's in biochemistry, which we've discussed, and public health. And she's a general surgeon too. So, we're not dealing, we're dealing with somebody who knows their stuff, in other words. So it's all good. You can find me, Dan Cardelicchio, whatever. It doesn't matter at this point. After this conversation, it's all good. You can find me. People find me. So, Dr. Aimie, thank you very much.
Thank you.
Always a great conversation. I want to thank everybody for listening. And, if you think you need Dr. Aimie, contact her and then start the process. It's confidential, doctor-patient confidentiality. Nobody knows anything. And you can start the process and you can start healing, which is really what you should be doing. So thank you, Dr. Aimie. Thank you for everybody for listening. Contact her. My pooch is in here and he's just waking up and he's barking. So I'll talk to you. We'll talk to you soon. Take care.